Well, it's been a really long time since my last video. I've kind of slacked on the video posting front. It's been actually 8 weeks. I wrapped up my FEC treatment pretty well. Shortly after I finished FEC, I got a couple of little peach fuzz growing out. It's been actually 5 treatments into my weekly Taxels. And as you can tell, my eyebrows did fall a bit on Taxol. They never really fell on FEC. However, my hair started growing out significantly. It still falls out a bit, but for the most part, I have a little bit of a shade now, and hopefully, I'll be sporting a crew cut by the end of my treatment, and by Christmas I'm hoping I'll have a significant pixie haircut. Anyways, so I'm really excited on that front, on the hair front. The treatment's been going well. My oncologist says that my tumor has shrunk significantly. I haven't done an MRI because they said that the nucleus, I guess where they believe the tumor started, my breast, is shrinking. They barely feel it anymore. So that's why we had pursued the neoadjuvant treatment, which is a chemo first, try to wipe out the tumor like that, and then they go in for a mastectomy and pretty much wipe any remainder that's there, and it's good to basically avoid the recurrence of this. I'm going to undergo a bilateral mastectomy. Even though they didn't detect a tumor on my left breast, typically, if there is a recurrence, it comes back on the unaffected breast. So to avoid that and having to go through this again, which I don't recommend to anybody, I'm undergoing the double mastectomy. I was also told that more than likely I'm going to have to do radiation, which is weird because typically if you have a mastectomy, you don't have to do the radiation. I think the radiation has more to do with the lymph nodes that were affected. So when I get more information on that, I'll update you all on it. But that has actually screwed up my plans for my breast reconstruction. Originally, I thought I was gonna put fabulous implants on and have the rest of my body be unaffected. Apparently, radiation messes up your skin, and there's a procedure now called a deep flap. They kind of essentially do like a tummy tuck, taking the skin from your stomach, putting it up top. I'm really going to try to avoid that mess, because even though I have a tummy now, you don't really care about the way you look when you're pretty much bald. But if you do, you'll pretty much shoot yourself. But I'm pretty confident in the rest of me and the beauty that I have on the inside. I'm trying to focus on that in this time. Keeping healthy, trying to do a little bit of running, trying to eat well, but it has nothing to do with pretty much trying to look good at this point. It's more health related, and but I really don't want them cutting up any other part of me. Leave the rest of me alone. This is the affected area. So if worst case scenario, if they can't do the implants, I'm thinking of just going flat and focusing more on the running and the looking good and being sporty. And there's a ton of girls that don't have boobs, and after I have kids, maybe I'll consider the deep flap. A lot of people like doing tummy tucks after kids, so if I need it, I'll do it at that point. But I'll keep you posted on my surgery. I am pretty much at the halfway mark with my second treatment, so I'm 3/4 done in the whole 24-week plan. So I'm really excited about that. I'll be a real happy camper when I don't have to knock out from the medication that they're giving me, the chemotherapy. And more than the chemotherapy, I think I'm knocking out now because they give me Benadryl, which is a little odd. They are giving me Decadron, which is a steroid, and they're also giving me Zantac, I guess, to prevent like some kind of an acid reflux. The Taxol and the weekly Herceptin, typically. But that's pretty much how it's going. On the last video, I had mentioned to you all about my port and how they give me my medication through here. The cream that they use isn't Novocaine. That's for your teeth, sorry. It's a lidocaine. Lidocaine is a cream that they prescribed to me so that I wouldn't feel the needle going through. So if any of you have the Metaport and you haven't been prescribed that, it really doesn't hurt, but why are you going to feel anything? So that's my take on it. So you have to deal with enough needles already. If you can numb one up, you might as well go for it. So, but everything's going really well. I'm really excited. I'm so surprised looking back at how the time has really flown. And if anybody else is going through this, I just want to let you know that hang in there. It's going to get better. And this too shall pass, which has been my motto. So take care, and thanks for checking in again.